I've been working in biomedical engineering for a long time now, and I've done some research on total hip joint replacements. So when it came for me to need one, I began to think of things in a slightly different way, and I was asked to talk about the patient's perspective on these things. And it was quite an interesting journey I went through in first of all, realising that I had a problem and then seeking help to get this problem sorted out. I really came to the idea that we need, as medical device innovators, to really keep the patient in mind. Every patient is an individual, has their personal life history, and they've been through a lot of stuff in order to get to the point where they need a medical device. The idea that you need to consider the patient and the journey they've been on before they come to have this interface with a medical device, and then to look at the implementation of that device and the fact that the person that's going to use the device is going to use it for the rest of their life. We need to be aware of all these implications. The whole procedure of being aware that you have a problem and then seeking help for it is quite a long process, and because I knew quite a lot about total joint replacements, there were advantages and disadvantages to that. Some of the advantages were that I knew the outcome should be good and I could choose the implant I wanted because I knew it had a good outcome. But then afterwards, going through the process of rehabilitation and getting used to having a slightly different body, but being able to get back to the things I wanted to do, and I realised I had lost the ability to do beforehand. So going for long 3-day hikes in the wilderness and going back to martial arts was something that I really wanted to do, and I've been able to do that, so it's been a good outcome. Until you go through it, you don't actually know what the process is. So the rehabilitation, the first couple of weeks were not very nice at all, but then you gradually work your way through it and you rehabilitate and you get mobile again, and you begin to realise that you can move around that's pain-free again, and then you can get back to more normal activities. But it does take a while, because your body has changed a lot in the year or so it's taken you to come to treatment. So it takes a while to adapt to how your body has changed and then get back to more normal activities again.
Was it something in all this that surprised you, or since you have all this experience?
Yeah. Not really. I don't think I was really surprised by it. I suppose in a way I was surprised at quite how long it took me to really forget that I got an implant, because very often these days I don't realise I've got it, and then occasionally something happens and oh yes, I've got a hip replacement, but most of the time you don't think about it at all now.